You know, driving a car and driving a fast car can actually get your blood going, get your adrenaline going, that's for sure.
Well, high blood pressure often often leads to more serious ailments such as heart disease and diabetes. And with the advent of home use blood pressure monitors, patients are now able to monitor their blood pressure regularly in the comfort of their own homes.
But how do you ensure that you are taking accurate readings, and how do you know when you should be heading to your doctor for further checks? Well, we pose these questions and more to cardiologist from Navina Heart Centre, Dr. Jimmy Lim. Good morning, thanks for joining us. Let me start off by just asking, when we get all these kits, we do them at home. What do you think is one of the things that people most commonly do wrong?
Well, I think, first of all, the main thing is that a lot of people don't even take the machines out of their closets. They buy the machines and they don't use it. So it's not useful if it's stuck in your closet. So I think the first thing is you need to actually use the machines that you buy. And then there are actually prescribed ways in which you should use it in terms of in what position you take it in, at what time of the day you should take it. So generally we recommend that if you're going to monitor your blood pressure at home, first of all, you want to get the right machines, and actually there's certain websites that can tell you which machines are kind of approved and validated that they're accurate. And secondly, then you can go on to measure it, and usually you want to do it like in a seated position when you're resting, not after exercise, certainly not after a cigarette smoke or after coffee, for example. And then you want to kind of stay still, measure your blood pressure once in the morning, usually first thing when you get up. And for those people who have high blood pressure, for example, you want to make sure you take it before you take your medications. And that's kind of going to give you the highest blood pressure you'll probably get for the rest of the day. And then to take one in the evening, so you can see what your blood pressure is sort of average throughout the day.
Right.
Yeah.
And how do you monitor this? Do you have to do it like every day and collect the information, and then, in a month come back and see how your heart blood pressure has fluctuated?
Well, I think it's going to help your doctor a lot, if you do that. Generally, we say that if you take like 2 readings in the morning and 2 in the evening, giving you 4 readings a day, you do it consecutively for 7 days in a row. That will give you a very good trend, and you can calculate an average from that. And based on that average, if you show your doctors those numbers, they can help better decide in some cases whether you do have high blood pressure if you've not been diagnosed with it before. Or in other situations, if you're already on high blood pressure medications, it doesn't necessarily mean that you're already well controlled. So again, you can help your doctors decide if the control has reached those optimal targets.
Well, you know what? We have one of those blood pressure monitoring machines here. So maybe you can show us how it's done exactly. I think maybe Suzanne, you want to... You can be the patient. But yeah, so I guess, can it go through clothes? I mean, you need to have a bare...
ideally, you shouldn't wear anything that's too constrictive.
Okay.
But for
anyway,
convenience...
demonstrations.
Very simply, most of these machines are typical of this. They're all digital monitors. And there's usually how
tight should it be?
It should be fitting, but it shouldn't be to the point where, your arm goes blue. You just wear it like this, and then you tend to press a number. Let's see what it works through the clothes. Ideally, obviously, you don't want to be wearing a jacket over it. So you switch it on, and then it just does everything automatically.
Let's hold this up. So,
how long does it take?
Usually about maybe 30 seconds.
And how accurate are these home monitors compared to those readings that we get at the clinics?
Yeah, actually, I have this question all the time from my patients. And what we find is that it's not that the monitors are inaccurate, because when we get the patients to bring the monitors into our clinics and we check, they're usually within about 5 points from what we get from a manual reading. But it's more that a lot of patients don't quite have the same blood pressure at home than when they come to see the doctor. For example, some patients are particularly anxious, so they get this condition called white coat hypertension. So it seems that they have high blood pressure, but then at home they have a perfect blood pressure. And in this case, we've finished reading already, so you can see the numbers.
So it's
123 for the top number, 80 for the bottom number,
accurate, isn't it?
and about 62 for your heart rate. So it's even through your clothes, it's doing a pretty good job.
So what do the numbers mean for people who don't know?
So we have certain numbers that makes it kind of easy for us to help us decide what to do. So essentially, true normal should really be about 120/80, which is what you have right now. But anything above 140 would be considered abnormal. So we have a simple classification. If you run between 140 to 159, that's called stage 1 hypertension. And then stage 2 is anything above that. And so if you have stage 1, it's mild. If you have stage 2, it's more serious. But regardless of the stage, I mean, hypertension can lead to problems like stroke, heart problems, and even kidney problems.
So I'm a healthy person, active person, and in my age range, people don't usually have blood pressure problems. So we don't need a machine like this at home. Who are the people who really should have something like this to monitor them daily?
Well, it's true in the sense that most young people don't have it. Having said that, we do see people even in their early 20s and early 30s who do have the beginnings of high blood pressure. And one of the things I always tell my patients is that blood pressure unfortunately rises with age. It's an inevitable part of aging. So if your blood pressure right now is about 120/80, when you get to 50, it's probably not going to remain at 120/80. It continues to go up. So although we have these sort of cutoffs at 140, for example, for hypertension, we can't be so specific to say that at 139 you're fine, and then somebody 141 is in trouble. It doesn't quite work that way. Our body works in a continuum. And so what we have to be wary about is that with home measurements, if you are sort of even 130 right now, it's good to have a home monitor. We can monitor maybe every quarter or every 6 months and see that trend to see if your blood pressure is sort of progressing rapidly. Because again, early diagnosis of high blood pressure means early control, and the earlier you control it, the less likely you're going to develop problems.
Now you mentioned as we get older, the number will go up. So is there an upper limit? I mean, a maximum limit, for example, that no one at any age should ever go over?
Well, actually, we take the same cutoffs for regardless of age, and in the past, we thought that as you age, your blood pressure goes up, so it's natural. But unless one considers it natural to get a stroke when you get older, we now know that intervention with medications for control certainly would prevent such these bad events. A study was done in the US that showed that if you have a perfect blood pressure at the age of 55, that's 120/80, about 90% of people when they get to 75 will have developed a number above 140. So hypertension is certainly very common. If you look at the National Health Survey within Singapore itself, about people in the age of 60 to 69, more than 1 in 2 people have hypertension. So it's a very, very common problem, and as you get older, it gets even more common.
Well, in the market, I've seen these types, but also there are those using your wrist and finger, isn't it?
Yes.
In terms of accuracy, would they be just as competitive?
It's not as straightforward as that. Usually for simple blood pressure monitoring, we do recommend the ones that you use the upper arm. However, there are some nowadays a different type of device, not just a blood pressure monitor. Those blood pressure monitors that measure the wrist tend to be slightly less accurate, but there is a different type of watch available nowadays that measures a different type of pressure. It's called central aortic pressure. It uses some algorithms to try to figure out what your pressure is near your heart rather than the periphery. And I think that's a very interesting area, but right now it's not quite prime time, I would say. We have less data on it. But generally speaking, for simple blood pressure monitors, I think the ones that use an upper arm are still the ones recommended.
And do you go to see a doctor immediately when you see that your blood pressure has gone beyond 140?
Well, I would say that you shouldn't worry unless your blood pressures are very, very high. If your blood pressures are slightly high, you will eventually get problems with it as you age. But you have time on your side, so you still can go and see your doctor, and maybe then they can figure out a plan to see whether you can get onto lifestyles to kind of lower the blood pressure.
Okay, and like with all these machines, just be sure that you sometimes need to check the batteries and stuff like that because I mean
proper usage will give you the most accurate reading.
Exactly. Well, that was cardiologist Dr. Jimmy Lim with advice on how you can take accurate readings using home blood pressure monitors.
That's right. We're going for a quick break now. We'll be right back with more news updates. Stay tuned.